Every year, the U.S. healthcare system loses an estimated $150 billion to patient no-shows. Revenue simply evaporates when patients fail to arrive. For the average independent physician practice, that systemic loss translates to $150,000 in unrecovered revenue every single year. The financial damage rarely stops at a single day. Data shows that a patient who misses one primary care visit is 70% more likely to never return to that practice within the next 18 months. These empty slots are permanent deductions from your bottom line. Your rent and utilities and staff salaries remain at full price, while the revenue for those time slots is lost forever. Most practitioners view this as a technology problem, but more than half of medical group leaders identify finding qualified candidates as their top challenge. Scheduling is a staffing crisis. High call volumes cause front desk overwhelm, generating scheduling errors and staff burnout. This turnover forces a cycle of retraining. While base salary is $42,000, adding taxes, benefits, and recruitment brings the total in-house hire cost to $60,800 per year. Relying on these manual systems consumes 12 to 15 hours of staff time every week and results in scheduling errors or double bookings in up to 40% of cases. Practices are paying over $60,000 a year for a manual workflow that leaks revenue and drives their best employees to quit. Solving this requires moving from distracted, shared staff to a dedicated remote scheduling team. Staffingly provides managed professionals who focus exclusively on the schedule, so your in-house team can focus on the patients. The process relies on real-time EHR integration. By using live API connections to your calendar, the remote team eliminates double bookings that occur during manual lookups. They also perform pre-authorization. Remote coordinators verify insurance eligibility before a slot is confirmed, preventing the billing headaches and claim denials that often occur when this step is skipped. When a cancellation occurs, the team manages an active waitlist, instantly contacting standby patients to fill the gap and recapture that revenue before the hour passes. Decoupling the phones from the physical front desk turns scheduling into a controlled, proactive workflow rather than a source of constant interruption. The Staffingly solution adds a layer of artificial intelligence to the human workflow, allowing the practice to predict no-shows before they happen. The system analyzes historical data to learn patient cancellation patterns. It then suggests optimal appointment times that minimize provider idle time. High-risk patients are managed through flag and hold policies. Chronic reschedulers are automatically identified and booked with stricter confirmation windows and buffer times. To ensure patients arrive, the system uses a multi-channel approach, sending automated texts, emails, and calls to outperform the inconsistent results of manual human dialing. Combining remote healthcare professionals with AI pattern recognition neutralizes scheduling chaos long before it reaches the provider's calendar. This returns us to the financial ledger and that $60,800 annual cost for a single in-house scheduling hire. Staffingly's dedicated remote virtual medical assistant costs $21,600 per year. Compared to an in-house hire, that is a 64% reduction in overhead. This switch creates $39,200 in direct annual cash savings for every hire replaced. The operational impact is equally measurable. Practices using this model report a 40 to 60% reduction in cancellations, actively recovering the original $150,000 revenue leak. And recapturing lost revenue and slashing administrative overhead, practices typically see a measurable return on investment within 60 days. Onboarding requires very little friction. The system goes live in 48 to 72 hours and requires zero training time from your existing in-house staff. The platform is trusted by over 800 providers nationally and maintains full HIPAA compliance, strict SOC 2 protocols, and HITRAST data security. Smart practices are moving away from the manual hiring spiral. By offloading the phone queue, they empower their clinical staff to focus on patients while permanently sealing their revenue leaks. Stop treating your schedule as a staffing nightmare. Book a demo with Staffingly today to see the exact math for your practice.